Hello, everyone, and welcome to another audio podcast as part of the radio edition. This is an audio podcast as part of a research and analysis, an audio podcast in around an overview of collaborative, another collaborative works, and in around another art book. And this is another art book that's in production, and this podcast as part of this audio podcast in around this an overview on this art book, in on joining the dots on data series, on data series, and this audio podcast is in around the science convoy, and this is an audio podcast as part of a Storm Robotics production, and where the art books the art this art book is part of Storm Robotics collaborative. This art book is for allied health professionals, frontline health professionals, um, multi those multidisciplinary teams, healthcare service users, healthcare service providers, long-term healthcare disease sufferers, and for those in the public domain, amongst the general public. And the art books this art book is use this art book looks at art linked to important elements of healthcare between healthcare sectors, again from a scientist's perspective, and to raise understanding of health and disease through art, joining the dots through suggestions through suggestions for sort of educational modules for healthcare service users. And the crux in around this again is around using art to reflect healthcare and to prevent sort of disparities, and also highlight equality. And the art book, TOC, or table of contents, has some basis in around an introduction, looks at in looks at it looks at an introduction looks at an introduction, and has and also sort of looks at sort of analysis, or an overview in around in around in around retrospective works looking at young people suffering with chronic kidney disease from 2012. Looks at the Lord Mayor of Bristol Blood and Organ Donation campaign from 2015. Looks at coping in young people from 2015 and 16 in context of original research. Looks at service evaluation for young people suffering with chronic kidney disease in context of research from 2018, and looks at scientists providing educational support from peer review works from 2020, and a peer review works in around scientists and primary care from 2020, as well. And also looks at there, as part of the TOC, or table of contents, there's works in around there's this art book provides a basis in around education empowerment and practice excellence in context of peer review works from 2021, educational support surrounding CKD in context of qualitative inquiry, where this peer review works is um, is uh, 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 is is will look to be sort of published at some point, in this year. The This art book also, as per the other art books, has acknowledgement pages, dedications pages, and sort of a summary page, and a little bit in around the intro for as part of this art book. So the provision of educational support can improve healthcare service users care, but healthcare service users care, but there are disparities, but there can be disparities between healthcare service users and who are, for example, self-motivated to navigate elements of healthcare, and those who seek understanding and yet have a little desire to becoming self-empowered. And the role in this art book, and in around some peer review works as well. There there's the intro is part of this. The intro in this also highlights there's some aspects around the role of point of care education, or POC, and online consultations for nephrology patients, for example, through online support groups is contextualized, highlighting reflections and outlining some conclusions. And often healthcare service users are not prepared or always aware of diagnosis in the context of disease severity, and access to AHPs, allied health professionals, through online space aligned to POC. Uh, Aligned to POC would support patients surrounding quality and evidence-based practices. And in this art book, as sort of alluded to, there are there are sort of a list sort of there are pages that outline sort of educational modules that link to themes in around particular disease aspects of disease, and where the where the themes had been co-developed between two social media platforms: the Renal Patient Support Group, the RPSG, and the Kidney Disease and Renal Support Group, or KDARS for kids. And there are within this art book, the educational modules, or the educational module part of the educational modules, um, are based on where healthcare service users, in amongst and between the two social media platforms, highlighted where for example there have been where it would be where it would be quite helpful for healthcare service users to get certain understanding in around different aspects of these particular themes. And so, for example, there's context in around different forms of sort of treatment pathways, treatment and treatment care. For example, there's sort of educational modules in around sort of laboratory tests and biomarkers. There's some list some or a list of sort of educational modules linked to primary care, in around primary care, and in around sort of peer support as well, in around surgery, in around looking at surgery, looking at and looking at sort of for example, wellness and well-being, and in around sort of looking at infections, and and in around some other important themes. And throughout this art book, there is a synopsis of there's a synopsis based on and around sort of peer review works, and there is art in this art book in context of a sort of a healthcare a proposed healthcare educational a proposed healthcare educational integration as part of a particular a part of a disease, a part of a pathway where healthcare professionals, different kinds of healthcare professionals can be involved, as well as healthcare service users, and where the pathway links links to whether the care pathway or the schematic, or there's a schematic as part of this art book, and where the pathway is linked with an algorithm, an algorithm which is depicted as another schematic, as a second schematic in this art book, looking at as a sort of a guide to assess healthcare service users to access peer support and or sort of AHPs, allied health professionals, for advice and guidance in context of in context of educational support, and where the algorithm in this looks at has for example six different aspects. For example, where there's where is depicted that for example, if as part of the initial part of the algorithm is to decide how to connect following initial review, and then following private email, instant messaging, set up a phone or video call, and then access patient patient or service user through an online consultation, and then where where it's been depicted in the schematic in around looking at health history advice, education and evidence basing, and where, for example, under under and sorry and thereafter there's as part of this sort of schematic, there's an overview in around looking at organized and sort of follow up, continuing care and advice and educational support, and then also decisions, and then sort of decisions, actions, and next appointment summary. And this schematic as part of this particular algorithm, in this in as part of this algorithm, there are several parts to the different sort of there are several sort of aspects to the different parts of the algorithm, and where 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 in effect the between two social media platforms. For example, the base is that, depending on the scenarios that come through, or the different things that are shared or highlighted through the two social media platforms, the algorithm, or the idea, a developed algorithm would then help into identifying sort of which healthcare professionals and which healthcare service users can be involved as part of the sort of care pathway. That's Again, that's depicted as part of schematic one in this art book as well. So again, the this art book highlights various educational modules that can be sort of that sort of highlight initial basis around co-developed educational modules, and the idea is that the educational modules are sort of co-developed further. However, this art book sort of initially provides an overview of educational modules aligned to sort of peer review works and peer review works sort of retrospectively. There's acknowledgements pages, sort of dedications pages, and sort of a summary page, where and sort of a page in this art book that is linked that has an overview in around the two social media platforms as well. So the and so this art book is was another a collaborative effort, and this art book is will be in production. So that draws a close to this audio podcast as part of this radio edition, looking at sort of research and analyses in around sort of an overview of an art book, another art book in production, and this art book is in around is and will be in around joining the dots on data series and looking at sort of looking at this works joining the dots on data series as part of the science convoy, and this is an audio podcast as part of another Storm Robotics production, and where the art book as per as per the as per other art books as part of a Storm Robotics collaborative. Thank you.